Quiero ver el champagne or in the how many work in our body.
Yeah. Facts about how medicine work inside our body. So medicines, when we
Quiero ver of in the business of diabetes that would have made life easier for patients.
yeah.
Mm.
So basically, my research is on this. I'm working with plant-based medication for diabetes. Uh, yeah, so it is as it is not already out yet, so I won't take the name of the plant. But then, yes, there are a few ways that we can actually, come back and assist in treating diabetes, especially the borderline diabetes. Um, so these are basically um, the plant, like for example, that are widely used are moringa. Moringa is very widely used. Then bitter gourd leaves, beet leaves, or even the fruit. So these are a few plants that actually helps. Neem is another, the bitter, the
Yeah.
ones that taste little bitter. These actually help in combating the diabetes. And there are different ways. For example, say even in medication, even the ones who have a very high diabetes, there are new ways. For example, the patients who are on insulin, they use insulin pens, which are very easier now. They have sensors attached to the body. Whenever the body needs insulin, it's automatically they get injected with very less pain. Then we have insulin pumps that are very like small
Yeah.
wearable devices which delivers insulin continuously. Then in that way, we also have patch like insulin patch pumps that also delivers insulin. Then we have non-injectable methods also. There are still under research. There are oral insulin pills, like there are inhaling insulins like Afrezza. They are rapid acting insulin powder inhaled through the lungs. So these are a few new, there are transdermal patches that slowly release insulin or other diabetic drugs also
Yeah.
into the body. So these are a few, what do you call, the drug delivery systems
Yeah.
that are being done, other than the traditional medicines that patients they usually take.
Yeah. And it help is learn or about how many work in our body.
Yeah. Facts about how medicine work inside our body. So medicines, when we eat the medicines, basically there are two processes: pharmacodynamics and pharmacokinetics. Pharmacodynamic, what the drug does to our body, and pharmacokinetic is what the body does to the drug. So this basically what happens is, in case of, like, say, for example, pharmacodynamics, how a drug affects the body, we see. Um, for example, when we have the drug, when it reaches the target, or a receptor when we call it, that shows its effect. Like for example, the example amlodipine we take in case of lowering blood pressure. So when this particular drug reaches to the say receptor site on the cell, then that does its action. So pharmacokinetic basically is about the what the body does to the drug. Yeah, pharmacokinetic. So it is about the different processes, like for example, absorption, distribution, metabolism, and excretion of the drug. Yeah. But whereas pharmacodynamics is what we say what the drug does to the body. It's its effect and how strong the effect is. So basically, pharmacodynamics, like how the what the drug does to the body, if we want to see, we can see it in different aspects. Like there are receptors in our body that are proteins that are there present on the cells that binds these drugs, takes these drugs and acts. So I'm just explaining it in a very easy terms. Then there are this depending on the dose, this particular drug shows its efficacy. There's this therapeutic window, how safe the drug is. For example, if it is more than a particular range, then it becomes toxic to our body. So that's why based on this, what the drug does to the body, based on this, we have these doses of the drugs. And that's why there are certain drugs that should not be taken more than certain time. It should be either once a day. That's why there are medicines that you only need to take once a day. There are medicines that you need to take twice a day, medicines that you need to take thrice a day. So based on that, yeah. For example, one example I would like to give how what the drug does to the body is like in case of diabetes, when we take insulin, so insulin binds to these insulin receptors that are there. Yeah. And they increase this glucose uptake. That's how in our blood, then we have a normalized blood glucose level. Yeah. And that's how it lowers our blood glucose.
In this area of how in the food is or fitness is maybe of many work in our body.
Yeah. So sleep actually works wonders in our body. So when we have proper sleep, we are actually our body is going through its self-healing process. Yeah. So there are um, some medicines are there that works better on empty stomach. Some they need food. So what happens is when we have lack of sleep or high stress, they can change how our body absorbs um, or how whatever our these processes are there, absorption, metabolism, excretion, yeah, distribution, metabolism and excretion. So these processes might get hindered if our sleep cycle is not proper.
Now the main but of many owners in would be a what the dinner below good of good that below for noise of
Yes. So buying medicines online is nothing bad. But if it is done like again on a self-medication basis, then that becomes very dangerous.
yeah.
Otherwise, buying online medicines, nowadays there are different reliable sources, regulated sources, trusted sources that actually give good medicines and good amount of discount as well.
Yeah.
Uh, but otherwise, usually, if one has a known pharmacist, then one can get from them, because then you know the source, it is more reliable. Otherwise, there are chances of involving fake or expired medicines, wrong doses of medicines, or some unsafe combinations of medicines that might get delivered to you. So in case, then it becomes a tedious task to again, return the medicines. So
Yeah.
that's why without experts' guidance, this risk increases. So that is why it is very much necessary that even the online medicines is done under the guidance of a physician
Yeah.
or a professional.
In the US, we have made major for 1 month based on their DNA on body.
Yes, yes, I think that is how we should grow in the medicines, not only allopathy, but even if you see homeopathy or Ayurveda, um, homeopathy already has this, personalized or specifically tailored medication for that individual. So this is actually the way of treatment, most effective treatment, I would say. So advances in genetics also may allow medicines to be tailored to persons, to the patient's DNA, making treatments more effective with very fewer side effects. So this type of medication we call pharmacogenomics, which is based on the genes of that individual. Yeah.
What more do learn more of pharmacology?
So to learn more about pharmacology, especially, I don't know, the particular patient who is having their medicine, they can at least read the, particular, there are leaflets that are available with the medicine, even if they're having some antibiotic or something, then there are leaflets with coming with the package. They can at least read those, especially for some specific medications, you get leaflets. So you can study those leaflets regarding the medicine that they are having. If that medicine has side effect with or interacts with some food, then they should be careful of. So that is mentioned in that leaflet. So in this way, they can at least read those leaflets. Yeah, and otherwise, they need not have much of, I mean, as a patient, they need not have much of the, what exactly is happening in the body. It's okay. It's for the pharmacist and the doctor to take care of that.
We know I do I I have have for me beyond of my it is what to allow everybody.
They are very, very beneficial, I feel, very innovative, and I feel it should be, shared with as many as possible with the friends who have speech disability, so that they are not limited. They are even freed of their bondage. So I feel it should be shared with as many as friends possible, to have this access to this particular application.
Yeah. thank you so much for sharing your insight with us.
Thank you. Thank you so much. Thank you so much for inviting.
This conversation will help people to understand the implications of medicine.
Thank you. I'll be very happy if this helps the viewers, the audience, to have a better understanding of how they can use the medicines in a more effective way.
For everyone wanting to be a life a customer on board. Share heading you in the next episode.
See you. Thank you.